Hello everyone, today we're going to talk about oncology. As you all know, that cancer is one of the worst diseases that can affect any person at any age group. Cancer may affect any organ in the body, as it can affect one of the blood components and result in leukemia and lymphoma. These cancers may be unknown to you and you know very little about them, so in this video we will explain to you everything related to blood cancers, such as how they occur, what are the most important symptoms, and how they can be diagnosed and treated. Our role today is to answer most of your questions regarding leukemia and lymphoma. Today we have Dr. Kim, who is a leading doctor at Ewha Seoul Hospital. He is going to discuss with us everything about leukemia and lymphoma from an experienced medical point of view. And before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Good morning, Dr. Kim.
Good morning.
Nice to meet you. Can you please briefly introduce yourself to our viewers?
Okay. Hello, my dear friends and my patients. I'm Dr. Kim, Daniel Kim from Ewha Medical Center. I am treating patients with hematology malignancy and leukemia, and also the benign hematology disease.
All right.
Thank you.
Dr. Kim, so what is hematology oncology, and what diseases does it deal with?
Blood disease is a disease that treats various blood-related diseases. It treats various diseases related to red blood cells, white blood cells, and platelets. And among these diseases, it treats diseases such as blood cancer and leukemia.
So what is exactly leukemia, and how many types of leukemia are out there?
Leukemia is divided into acute leukemia and chronic leukemia. Among acute leukemia, there are two types of acute myelogenous leukemia and acute lymphocytic leukemia. There are two types of chronic leukemia, chronic myelogenous and chronic lymphocytic leukemia. There are 4 types in total.
So out of these types of leukemia, what is the one that is more serious or most serious?
Acute is more serious and critical than chronic. The patient's condition deteriorates quickly, and if not treated quickly, he may die within months. So it is important to diagnose these diseases quickly and treat them quickly.
So out of those types, what is the one that is most common?
Although similar worldwide, according to statistics in Korea, acute leukemia patients occur in Korea at around 5,000 per year, acute myelogenous leukemia patients at 4,000, and lymphocytic leukemia at 1,000. About 400 patients with chronic myelogenous leukemia occur annually. In terms of frequency, it is in order of acute myelogenous, lymphocytic leukemia, and chronic myelogenous leukemia.
So, leukemia, who is more likely to get it?
In the case of acute leukemia, acute myelogenous leukemia occurs in older people. Acute lymphocytic leukemia appears in both children and older people. Chronic myelogenous leukemia mainly appears in older people. Except for acute lymphocytic leukemia, leukemia can be explained as a disease that occurs mainly in older people, and when there is an abnormality in gene due to aging.
So usually what are the causes of leukemia?
The cause of leukemia is not yet clearly known. Some scholars and doctors think leukemia can be caused by chemical or radiation exposure. But it is very rare that such a cause has been identified. After all, the most important cause is genetic abnormality. Genetic abnormalities are innate and acquired genetic abnormalities due to aging. Genetic abnormalities that occur acquired cause problems in the process of making blood due to aging, which causes cancer, and this is the most common case. Therefore, leukemia can also be understood as an aging process.
So for leukemia, are there any symptoms?
Most leukemia patients have similar symptoms. When diagnosed for the first time, white blood cells, platelets, and red blood cells are usually poorly made, resulting in fewer blood cells. If white blood cell decreases, the immune function decreases, making it easy to be exposed to various infections and showing symptoms of fever and pneumonia. Also, due to anemia symptoms, I am out of breath, dizzy, or weak. If the platelets decrease, blood clotting does not work well, resulting in more bleeding. Through these initial symptoms, there are several serious symptoms caused by an increase in leukemia cells in white blood cells, which cause serious problems such as unconsciousness, body temperature, and blood pressure changes. Chronic myelogenous leukemia should be considered separately because the symptoms are slightly different.
So what kind of diagnosis can we do to see if we have leukemia or not? And if it's confirmed as leukemia, what kind of treatment can be done?
Good question. When diagnosing leukemia, the most important thing is blood testing. Blood is drawn and general blood tests are performed. And leukemia is suspected by looking at the results. The most important test in diagnosis is the bone marrow test. Through a bone marrow examination, check for problems in the bone marrow, the tissue that makes blood. It also finds the cause through various genetic and chromosomal tests and predicts the prognosis of how to treat leukemia in the future. In the case of acute leukemia, chemotherapy is performed. And chemotherapy is performed up to 4 to 8 times depending on the type of leukemia. And bone marrow transplantation and hematopoietic stem cell transplantation are one of the important treatment methods. In the past, chronic myelogenous leukemia was thought to be a must-have disease for bone marrow transplantation, but recently, 92 to 95% of patients have been cured with a cure rate as a way to cure them through medication has been developed.
Okay. Are there any ways to prevent leukemia for an average person?
As mentioned earlier, leukemia is most often caused by genetic abnormalities, rather than causes depending on environmental factors and eating habits. Therefore, it is difficult to overcome with individual efforts. It is important to receive treatment through early diagnosis rather than prevention, and before the condition worsens. When you have symptoms such as fever, shortness of breath, lack of energy, or bleeding with an unknown cause, it is important to go to the hospital quickly for a blood test, and to be diagnosed with leukemia early before the disease becomes serious.
Okay, Dr. Kim, what is lymphoma?
There are 2 types of blood in our body, including bone marrow and lymphocytes among white blood cells. These lymphocytes are mainly responsible for immune function in our body. The case where lymphocytes turn into the cancer for some reason is called lymphoma. Lymphoma is a phenomenon in which the lymphatic glands of the whole body grow, or lymphoma cells metastasize and adhere to other organs to form lumps. Simply put, it can be understood as blood cancer in lymphocytes.
Okay, so lymphoma as well has many types, or is there only one type?
That's a good question. Lymphoma is divided into Hodgkin lymphoma and non-Hodgkin lymphoma. Non-Hodgkin lymphoma has follicular lymphoma and various other lymphomas. So there are more than dozens of types. Diagnosis methods and treatments vary slightly depending on the type.
Yeah. So you just talked about Hodgkin's lymphoma and non-Hodgkin's lymphoma. What is exactly the difference between both?
Non-Hodgkin lymphoma is a more common form and shows a pattern of worsening faster. On the other hand, Hodgkin lymphoma is rare and shows a pattern of slowly fluctuating. In Korea, there are more non-Hodgkin lymphoma and less Hodgkin lymphoma. There are also more Hodgkin lymphoma in the United States and the Arab world. It is important to receive proper treatment.
Okay. So, doctor, can you tell us a little bit more about how we diagnose and then treat lymphoma?
The most important thing in the diagnosis of lymphoma is biopsy. If the lymphatic gland is enlarged in your body, it's important to be diagnosed with removing part of the lymphatic gland or perform a biopsy using a thick needle. It takes about 4 to 5 days to get a biopsy. When diagnosed with lymphoma, CT checks are performed to determine how far this lymphoma spreads. Imposturon tomography, PET scans, are performed to see more accurately where it spreads throughout the body. Since this lymphoma is a disease that occurs in lymphitis in the bone marrow infiltration is also checked through bone marrow examination. In addition, lung function tests and echocardiography are performed to ensure that the patient is in good physical condition in order to proceed with various treatments to the patient.
So, okay, that's it for the questions there. But my last question is, what is so special about the Department of Hematology and Oncology in Ewha Women's University Hospital?
Ewha Seoul Hospital has excellent medical staff. Of course, it is important that doctors have excellent skills, but professional nurses and all personnel who work together and cooperate are doing their best for patients. Usually, residents and intern teachers work together, but Ewha Seoul Hospital is a hospital where professors majoring in blood diseases directly treat them. It has the advantage that all processes of diagnosis and treatment of patients proceed very quickly and quickly. Usually it takes about 10 days to detect acute myelogenous leukemia in other hospitals, but we can complete all diagnosis within 2 days and proceed with treatment immediately. Rapid treatment is a great advantage. All facilities have recently been built up to date and prioritize patient convenience and comfort. The most important thing in treating blood cancer is the fight against infection. Because of the poor immune function, it is important how to prevent infection, and the older facilities, the more infections occur. Since everything supplied to patients, such as state-of-the-art facilities and air purifiers, is treated with filters, various lung-related diseases are prevented as much as possible to minimize infection. Lastly, since our hospital is close to the airport, which makes it more convenient for foreign patients to come visit.
Thank you so much, Dr. Kim.
Thank you very much.
Thank you. So today we learned many things about leukemia and lymphoma, and the doctor explained in details everything related to hematological oncology, such as its symptoms and how it can be diagnosed and treated. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.